All right, thank you everybody for listening in today. Our webinar that we're going to be presenting to you is titled Concussion in Adults, Recovering While Managing Life's Responsibilities. My name is Annie Randolph, and I am a Neuro Resource Facilitator with the Brain Injury Alliance of Iowa, and we are very excited to share this webinar with you today. Dr. Shawn Spooner is a primary care sports medicine physician at UnityPoint Clinic in Urbandale, Iowa. Dr. Spooner completed his exercise and sports science degree at Iowa State University in 2001, prior to earning his medical degree at the University of Iowa in 2005. He completed his family medicine residency training at Naval Hospital Camp Pendleton in California in 2008, followed by a primary care sports medicine fellowship with Naval Hospital Camp Pendleton, UC San Diego in 2011. Dr. Spooner served as a medical officer in the United States Navy for 9 years, where he served with the Navy and Marine Corps in San Diego, South Korea, Great Lakes, Illinois, and Afghanistan. In Afghanistan, he operated a regional concussion restoration care center specializing in the treatment of combat-related concussion and non-surgical combat-related musculoskeletal injury. He and his family returned to Iowa in 2013, where he now practices primary care sports medicine with UnityPoint Clinic. Dr. Spooner is the team physician for Chow's Gymnastics at Grandview University, Des Moines Buccaneers, and Adel, Desoto, Minburn High School. Dr. Spooner's professional interests include multidisciplinary treatment of concussion and post-concussion syndrome, as well as in injury risk reduction and prevention. He is published in the areas of concussion management, peri-partum depression, and effect of mood and exercise on immune response. Dr. Spooner has earned his Level 3 U.S. cycling coaching qualification and enjoys running, cycling, and cross-training sports in his free time. Thank you again, Shawn, and I will go ahead and let you get started.
All right. Thank you very much for having me today. I'm actually really excited to talk about this topic. So, I think we've all heard a lot about the management of sports-related concussions, and a lot of what's out there in the literature and in the media is about our high school athletes, football players, and whatnot that come down with concussions. But what I see in my practice more and more is the adult concussion, just regular moms and dads and folks out there with occupational, industrial, everyday type life concussions, motor vehicle accidents and such. And the focus has not historically been around their care as much if they didn't have a traumatic brain injury. And so we've been really kind of developing a pathway of care for those people. And I'm kind of excited to talk to you about my general philosophy on the treatment of adults. Not sure about the audience, so I've kind of kept it general, but I'm more than happy to answer questions from anybody after this. So get going here. So where I came from, as we've alluded to already, I have had some experience in the treatment of concussions on the military side. It's kind of where I developed my passion for the treatment of concussion. Originally, it was combat-related concussion care, but a lot of these folks are, they run parallel to those folks that we see with sports-related concussions. It's just a different mechanism of injury when you're dealing with blast injuries and things like that. But the concepts of treatment and care are very similar. We worked a lot together, data collecting on what worked, what didn't work around the treatment of concussion at the Concussion Restoration Care Center in Afghanistan. What we really learned from this is that an early multidisciplinary approach tends to work better. So the just waiting around and watching seems to allow people to develop sort of a funk that they have a hard time getting out of. We found that if we can engage them in an active recovery model of care, they do better faster. And so just to start off, what is a concussion? I prefer the AMSSM's diagnosis. I'll read it to you. A traumatically induced transient, that means typically temporary disturbance in brain function, involves a complex pathophysiological process. It is a subset of mild traumatic brain injury. It's generally self-limiting and is generally at the less severe end of brain injury spectrum. That's not to say that people have less severe symptoms necessarily, but that's the definition of concussion. What is the pathophysiology of concussion, we think, we're not sure. There's a lot of things we know about concussion. There's a lot of things we don't know. We think it is essentially a mismatch in metabolism or the energy requirement of the brain. There's something to do with the metabolic activity of the brain where it is unable to function at the capacity that it had prior to the injury. I liken this when I talk to patients to a software problem, not a hardware problem. Um, Grossly, the structure of the brain is intact. You'll see that on imaging studies if they're done in the ER and such, but the software is not right. There's something going on with the software, depending on how you get hit, where you get hit, all the various factors around that injury, the physics of that injury will determine what symptoms you will endorse after that injury. But it's a functional problem. Chemically, it may look something like this, a fluctuation of various types of ions, calcium, potassium, sodium, in the brain cells, and all of this kind of equates to the brain not being able to use our energy molecules effectively, and then it gets slow and less effective. What symptoms do people typically experience after concussion? This is your typical table of symptoms. Most commonly headache, some difficulty with balance, some functional vision problems, fatigue, sensitivity to environmental stimuli such as light and sound, a lot of cognitive symptoms. It kind of runs the gamut from memory problems, difficulty concentrating, just feel slow and ineffective, foggy, emotional ability, difficulties with dealing with stress, more depressive symptoms, more anxious symptoms, and then functional difficulties with sleep. There are many more symptoms that can go along with concussion as well. You'll hear people talk about post-concussion syndrome. Well, what is that, and when does that develop? There's not a real clear definition of when that is, but typically when symptoms have been going on for an extended period of time, there are multiple symptoms involved. We start to call it a syndrome or post-concussion syndrome. What is the difference between concussion and post-concussion syndrome? I'm not sure, but we kind of think of it as a multifactorial issue. Still, there's the metabolic underlying component, but there's probably some genetic component, and there's more and more research coming out all the time. I caution everyone to look at that carefully because we're not really sure how that's panning out. There are various types of genetic markers, alleles, there are promoter genes of genes, and we're not sure which ones are or are not the most important, but it is an exciting area of research to observe and follow. There may be more of a microscopic diffuse axonal injury component involved in these more prolonged post-concussive syndromes. And then there's the comorbidities that go along with this. What is the health of the individual before they get injured? Typically also most significantly around mental health pre-existing previous to injury. What's different in adults than in our youth? Well, they have different responsibilities. They have to go to work. They have to pay the bills. They have to take care of their family, and they have other responsibilities. They worry about finances. They have stressors that are real and immediate, where sometimes our youth have the luxury of a little more time and shelter from some of the responsibilities that will stress adults as they go through these injuries. Is there a difference in neuroplasticity? Is there a difference between youth and adults and how they recover from injury in general? And then again, the comorbidities that develop as we age. How do we manage concussions in general? Well, the cornerstone is rest. It's physical rest and cognitive rest, and that's difficult to necessarily adhere to, and everyone's going to be different in how they're able to complete and adhere to that kind of rest. But physical and cognitive rest. I think the most important piece of management of concussion is reassurance. If we can reassure an individual in that acute state when they are concussed and they feel out of control and they feel like they aren't themselves and they can't control their thoughts and their thinking straight and all that, just having the ability to reassure a person when they're going through this, I think is the most important thing. Try to manage that acute anxiety that comes with that injury, and that will allow them to frame the injury better and participate in their care and their treatment. Symptom normalization. the symptoms that individuals are experiencing during concussion are very worrisome. They're scary, and that's understandable. If you have any of the symptoms on the list of concussion, they can be frightening and scary. But to help someone, reassure them that these are normal symptoms for concussion, and that we will help get them through those in a meaningful way. And then I think frequent follow-up. Don't let people with concussions linger out on their own too long, where they can feel isolated and alone and unsupported. So frequent follow-up is a good idea, I think. What are the risk factors that we see in maybe delay of recovery? Probably multiple previous injuries, possibly female gender. I think the extremes of age, very young and older, tend to seem to prolong symptoms a little bit longer. A prior history of cognitive dysfunction previous to injury. That would be both maybe a history of depression, anxiety, learning disorders, ADD, ADHD, dyslexia, things like that tend to statistically correlate with longer recovery times from concussion. History of migraine headaches seems to correlate with complications of post-traumatic migraine, post-concussion headaches, and general recovery as well. And then too much physical or cognitive activity too early. Those that try to push through their injury off the bat tend to set themselves back a little bit in their overall recovery. On average, a concussion should resolve in a couple of weeks, but they may last much shorter, or they may last much longer. And every concussion is different. Everybody's different. Every concussive injury is different. This is a tough injury to just cookbook your way through. We have to individualize treatment. So everyone's going to have a different set of symptoms and needs and circumstances that need to be dealt with individually around their treatment of their concussive injury. And we find that the multidisciplinary approach with those individuals with certain skill sets in treating these individuals will be the best approach for people trying to get through concussion. So persistent post-concussion syndrome, or symptoms rather. Typically, it's noted that people who try to overexert themselves get worse symptoms. It's typical. People who have a physical occupation or have a lot of more physical demands, or try to push through physically in workout or whatnot, or sports, will see an exacerbation of their symptoms. Those who have to exert themselves more cognitively, if you're having to try to run board meetings or sit through meetings or phone calls or talk to people all day, that's a different type of overexertion, and that will exacerbate symptoms. And then environments with a lot of sensory input, those with more sound and light pollution and activity will be more difficult to deal with. And so everyone's environmental components will be different, and so we have to take that into account while we treat concussions. Generally, we want to return to normal activities gradually, not immediately, over time. I'll touch on a couple of the different areas, and then we'll get into kind of the specifics around treating these. Rest, sleeping. Your brain needs time to recover. It's important to get adequate amounts of sleep. You'll feel more tired than normal. It's not uncommon for people to describe it as hitting the wall halfway through the day. And so you need both physical and mental rest as much as can be obtained. Driving, be careful. Do not drive and operate machinery until you feel better and can concentrate and balance properly. Your reaction time will be slower. So if you are allowed to drive, we ask that you spend time paying attention to following distance and such things, because you may not be able to stop as fast as you thought you would otherwise normally be able to. And so just precautions in regards to daily activities such as driving. Drinking, medications and other drugs. Do not drink alcohol or use recreational drugs. They don't go well with anything, let alone concussion recovery. Medications. Don't take new medications unless you've been advised by your physician. Review your current medications with your physician. Some medications can exacerbate symptoms of concussion, and we just want to be aware of what you're taking. Working and studying, you may need to take some time off work, at least partial days sometimes, part-time off, or something sometimes is necessary to help during recovery. This goes along with studying as well. If you're still in school or taking classes, some accommodations around your academic work might be necessary, and we can help you achieve that through cooperation with your physician and care team. How much time you need off of work and study will depend on what you do. You need to let your employer and teachers know that you're having problems and you're recovering from an injury. And if you need special documentation and support, then your care team should be there to help support you in that. Sports and more high-risk lifestyle activities, it's dangerous to be in an environment that may put you at risk of being re-injured again. Talk to your doctor or your provider or care team about steps you need to take to gradually increase your activity and return to play and return to work. And when in doubt, sit out of those activities. Relationships. Sometimes your symptoms will affect how you relate to your family and friends. They sometimes won't understand. Concussions are invisible to people. They don't see that you've got a cast or a brace or crutches or something else that's obviously injured. And so they will have a hard time understanding what you're going through. And so there's educational materials. There are things that can be provided to you and your family to share amongst each other so they can better understand what it is that you're going through, and so that it doesn't affect your relationships as much in a negative way. So headaches, probably one of the more common problems after a brain injury. They can be made worse with fatigue, stress, other triggers. Sleeping, resting, taking breaks is important. Pain relievers can be helpful to break the cycle of headaches, but they can also cause headache if they're overused. And so we ask that we try to start initially with over-the-counter medications, but limit them to less than 15 days per month if possible. If your headache gets worse and cannot be relieved, then talk to your care team and your physician about that. Trouble with attention and concentration, difficulty with concentrating, feeling foggy and slow, trouble comprehending things. You'll find that you'll have to read things over and over again to understand them, and that'll be frustrating. Taking extra time to complete tasks will be important. Take plenty of breaks and do the most demanding work while you're the most rested. Troubles with memory and forgetfulness. This is a common thing as well. Word finding problems is a common thing described by patients who are dealing with concussions. Mental hiccups, they'll describe them. We suggest some coping strategies like keeping lists, reminders, notebooks, things to help you so that you're not having to use your brain to do all the work when you're trying to get through this. Ask family, friends, and coworkers to remind you when needed. Balance problems and the feeling of dizziness. This can be a lot of different things, but people will find that sometimes they feel sick and nauseated and uncomfortable when they have to move and change positions quickly or move too quickly or things move quickly around them in a busy environment. Avoid such sudden movements as much as possible until symptoms start to improve. If dizziness persists for more than a couple of weeks, then see your physician and care team and discuss this more. You'll find that you may be more clumsy, a bit more clumsy, more sense of imbalance, so not an uncommon symptom. Take everything you do a little more slowly. Your brain is a control center of your body, and it makes more sense out of the messages and inputs coming in through your eyes and your ears and other senses, and then to send the right signals back out to your muscles to do all the things that you should be doing. So give yourself more time, try not to rush, and avoid climbing, balancing activities that might put you at risk for injury again. You'll find maybe some difficulty with multitasking, decision-making, problem-solving. You find that you're less able to plan ahead and follow through on steps that are required to carry out an activity. These kinds of difficulties may cause particular problems during the first couple of days, but they're usually temporary in nature. If we can get people the right cognitive coping skills and strategies, people can tend to work through this. But this can be a problem, and this is one of the more chronic, persistent symptoms that I see in folks treating concussions. is this difficulty with multitasking and problem solving. When facing situations that present problems or opportunities to plan, it may be help to think things through ahead of time. Again, make lists, notebooks, these coping strategies we do to try to prevent the anxiety that comes along with this. Feeling foggy and slowed down. People describe this difficulty keeping up with conversations, or they just avoid conversations entirely. I think it's important to encourage others to slow down by asking questions, by having them repeat what they say. Again, try to communicate to them that you're dealing with an injury and that you may have a harder time in the workspace communicating with people. And allow yourself extra time to complete tasks and avoid situations where you may be under pressure to do things as quickly. Ringing in the ears is pretty common. This is generally temporary, but if persistent, sometimes additional testing might be necessary. Try to avoid excessive noise exposure while you're recovering. And the sensitivity to light. Sunglasses, important, sometimes even indoors. We think sometimes yellow or amber tinted glasses may be able to help more, blocking blue light, which is maybe a little bit more noxious to the brain as we recover. Decrease screen time, adjust screen brightness. Don't play video games. Avoid loud environments, noise canceling headphones, white or brown noise. Things like this are just some of many other coping strategies that might be able to help decrease the sensitivity to the environmental factors around us. And then just the sense of irritability, the depression, anxiety, mood swings, very common. Even if you haven't had a history of anxiety or depression in the past, it's not uncommon to have these feelings. And so we promote relaxation techniques, resting, meditation, sometimes even hypnotism can help with dealing with this component of the injury. Counseling, cognitive behavioral therapy, and sometimes medications when they're appropriate. Sleeping is a difficult time, often falling asleep, staying asleep, sleeping too much. This is, again, usually temporary and can be reduced by just good sleep hygiene. Trying to avoid sleep medications, I think, is a good thing. I try to limit medications in general when I'm treating people for concussions, but if your sleep pattern has been very disrupted severely, there are some things that sometimes can be done pharmacotherapy-wise temporarily to help support that in the short term. And then reduced tolerance to alcohol. This is a time where you don't want to try to overuse alcohol. We really think the brain doesn't tolerate this as well while you're recovering from any injury, especially concussions. So a little bit more specifics around these things I'll move through sort of quickly. But headaches, they can be multifactorial. So you have the concussion headache. You also have it's sort of pseudomigranous. It can be a type of tension headache, a cervicogenic headache. And so we treat this with relative rest, activity modification, over-the-counter acetaminophen, ibuprofen, sometimes combination analgesics. I try to stay away from any narcotics. Physical therapy, massage therapy, conservative chiropractic manipulation, acupuncture. Melatonin can sometimes help with this, and it's been compared against amitriptyline in some studies around the treatment of headaches. And it's also safer and has less side effects. Other specialty pharmacotherapy may be determined necessary in cooperation with your provider. Some of these headaches are migrainous, or people have had a history of migraine headaches in the past. There is a place for migraine abortive medications and prophylactic medications in the treatment of post-concussion headache. The general treatment of headaches, as described in the previous slide, is still the mainstay of treatment, but sometimes specialty pharmacotherapy and other treatments is necessary. Consider functional vision dysfunction. So a lot of times, just the problems with accommodation and convergence and tracking of vision can feed into this type of tension type headache. And so not ignoring the functional vision component might be an important component also to the headache management. Persistent weak sleep, wake disturbance, again, sleep hygiene, cognitive behavioral therapy, some medications can be potentially useful. Again, melatonin I always start with. You can consider other things such as trazodone, tricyclic antidepressants, and others, but just note that all these medications have side effects and risks with use. And I think in the more conservative approach we can utilize, the better. You will sometimes see some issues with more kind of pervasive sleep problems, post-traumatic narcolepsy. Sleep medicine consult would not be out of the question for some of these more persistent difficulties with sleep. Persistent mental health symptoms. The general treatment of mental health, I think, should be with reassurance. That's the mainstay of all of this treatment, I think, is reassuring the individual. It's normal to feel anxious about these symptoms. It's also fearful to experience the symptoms of concussion. I think just reassuring people can go a long way, but sometimes enlisting the help of mental health resources for counseling, cognitive behavioral therapy, sometimes evaluation by neuropsychology to determine if there's more of a deep-seated underlying component of depression, anxiety, or other mental health disorders that are coexisting with concussion is important. Pharmacotherapy is sometimes appropriate. Always remember to use the lowest effective dose, sometimes lower than usual, and try not to make multiple medication changes simultaneously, and frequent follow-up is important. Persistent cognitive symptoms. So difficulty with speech and cognitive activities is not uncommon. Working with a speech and cognitive therapist can be very helpful. At UnityPoint, we utilize a speech therapist who specializes in cognitive rehabilitation and coping skills, and it is one of our more effective treatment modalities overall for concussion. She's really our concussion whisperer, so to speak. She just helps in so many different ways, from the mental health component to the coping, real world coping strategies component. But having a resource such as a speech, cognitive, or occupational therapist who specializes in concussions is an important piece of this. Again, neuropsychology, consultation when appropriate, coping strategies, and then work and school adjustments. Persistent balance problems or postural instability. Physical therapy can be very helpful. Sometimes it's vestibular, sometimes it's multifocal, and we shouldn't all just blame it on the vestibular system, but consider functional vision dysfunction, as well as discussed earlier. The disturbance in convergence accommodation can really be a huge factor in balance. And so sometimes even consulting with a specialty optometrist who has a background in concussions can be helpful. Take safety precautions when there continues to be persistent difficulty with balance, so we avoid further injury. Fatigue is a real problem. Working on environmental factors, workplace factors, taking breaks, taking naps, sleeping as much as possible. Light exercise, we think, is a good component of recovery. Active rest is important in the treatment of concussion. So just sitting around, resting in a dark room is not often the best way to treat concussions. Get out, go on walks. Light cardiovascular exercise can be therapeutic. And then addressing any other underlying mental health component to the fatigue is important. So what are the risks of repeated concussions? We think that the concussion risk increases after having had one or more concussions. We think previous concussions may be associated with slower recovery of neurological function. We think that repeated concussions may result in some lasting neurocognitive impairment in some individuals, but not most of them. And then this lasting post-concussion syndrome, as we discussed above, is a risk for a small percentage of people who suffer concussions. This is a controversial slide. There's a lot of media activity around chronic traumatic encephalopathy, or CTE. There's a lot we don't know about this. I think we need to be careful when we look at the research being done and the media spin around CTE. I think there's more to be learned around the chronic neurocognitive impairment piece, the persistent symptoms. I don't currently endorse that CTE is a natural progression of concussion. It's a multifactorial disorder that coexists, I think, with a lot of the other comorbidities, especially around the coexisting mental health component. We need to not ignore the mental health piece to the treatment of concussion. There's stigma around that, but I think it's such an important piece of treating prolonged post-concussive symptoms that it has to be a mainstay of that treatment protocol. And so that's my piece on CTE. Please take caution around concussion treatment. There are a lot of people out there that are trying to profit off of the fears of people around concussion prevention or treatment. Be aware of fraudulent treatment that is going on. When in doubt, talk to your primary care provider to vet some of the treatment that's being provided out there for concussions. Watch out for predators who are trying to feed on your fear and anxiety around concussion to make a personal profit. In summary, I think the general approach to concussion should be multidisciplinary. I think individualizing treatment around an individual specific environmental factors and treatment goals and underlying circumstances and symptom score and symptom spectrum is important. Reassuring an individual that they will get better, expecting recovery, not in dwelling on the injury and disability, but to expect improvement is important. Symptom support, work, school, environmental support. A lot of that has to do with paperwork and dealing with disability and FMLA and some of that. And we should be able to support our patients while they get through their recovery in that way. Don't over-medicate, don't over-pathologize this. Provide adequate education that's evidence-based. I put some resources here at the end of the presentation just for folks to look up if they want to learn more. This is my contact information. If you ever need to get in touch with me, I'm happy to talk more about what we do for concussions. I think it's an exciting area that we can really affect people's lives in a good way. I think there's a lot of folks out there that suffer with these symptoms too long, and the longer they go unsupported, the longer they suffer. So I'm hoping that this was beneficial and helpful, and I would open it up to any questions or thoughts or concerns or anything.
Thank you, Shawn. That was great. I'll just give some time for people to enter any questions that they have. And while you all do that, if you'd have a question, feel free to put that into the question box. As a reminder, just please reach out to the Brain Injury Alliance of Iowa if you're ever in need of any brain injury resources or information in general. Our Neuro Resource Facilitation Program is designed to help connect individuals with brain injury along with their loved ones and the professionals that are serving them in Iowa to needed supports and services in the community. And additionally, the Brain Injury Alliance is always available to provide any case consultations to professionals if you have a client with a brain injury and you are looking for resources or support in figuring out what to do. So we had a couple of questions. Let's see, from Michael, have you ever worked with any supplement-based additives towards concussion symptom management, such as magnesium, nitric oxide, etc.? Do you want to speak to that, Shawn?
Yeah, I would say yes. I don't know if I've got a lot of evidence base behind it, but to be very truthful and transparent, yes, I have had some benefit around specifically headaches with the use of not specifically magnesium as much as some other compounded products that I've used that seem to work. They're all pretty natural stuff, alpha lipoic acid, chromium, vitamin D. So I don't push any of that. It kind of comes down the pipe as I talk to patient. If we've, if they're, especially if folks are on a lot of other medications, I try to really stay away from more and more activating medicines. And so, if we can find something that's not a dangerous supplement that might have some, at least anecdotal evidence of improving symptoms, then I'm in support of that.
And have you ever used, at a Mayo Clinic, neurologist mentioned the use of, I think, amantadine, amantadine, amantadine in treatment during the one of our last brain injury conferences. Have you ever used that? Are you familiar with that for concussions?
Yeah, there's some information and evidence around that. I haven't personally used it. in my protocol yet, but um, I have I have been kind of exploring that a little bit as well. So I think that is just um, another another option. I think it's exciting, all these new uses of medicines and modalities out there. So I haven't used it aggressively here yet, but it may be something I look into more.
And another question I just have for you that I know that comes in frequently to our agency is individuals who, like you spoke of before, who have a hard time with employment and balancing that those responsibilities while also recovering. What experience or what would you say to those individuals who are um, struggling with staying employed and the amount of hours that they need to work to support their families while also recovering? What additionally would you say to those people of support that maybe they could look for or from you or from your clinic for that?
Yeah, I think that's probably one of the most frustrating things for me. I mean, I've had patients get fired, and I've had and it's sad and it's horrible, and so I try aggressively to communicate with employers, trying to share with them, look, this is a real injury. People aren't, for the most part, there is secondary gain, but rarely do I see that aggressively. What can we do to, even if the policy is, look, they don't have enough PTO hours yet or whatever, what can we do to try to support someone to just get over the hump? Sometimes it's just a couple of weeks of partial hours or partial work time that if we can just give that to somebody, they can still maintain employment and try to communicate to employers. Look, it often costs more to retrain someone, so if we can help to support them in the short term, that it can pay off for everybody. Um,
Right.
but I think I've had a lot of good luck around the functional coping strategies from our speech
Hmm.
therapists in particular, physical
Hmm.
therapists and speech therapists. If we can just make work a little less noxious by some simple coping strategies,
Hmm.
then we can try to maybe provide some meaningful support as well. So and it's just tough because not everyone can afford or have time to go to physical therapy and speech therapy. And so we try to do the best we can with at least maybe one or two visits to give them some strategies to cope.
Good. Another question that we have in from Michael is when you're allowing or working with your patient and talking to them about rest, but active rest, what aerobic exercises are you allowing them to do or kind of suggesting, and what kind of things are you thinking to help steer them away from while they're in that recovery period?
I generally recommend non-impact cardiovascular exercise. So I just think the jarring motion of the body and the head and neck sometimes can contribute to symptom severity. So I would say, stationary bike, elliptical machine, um, uh, things like that, and then you have to pay attention to the symptoms that occur with those activities. If you wanted to go into the evidence around this, we think that if people can exercise at about 80% of the capacity that causes exacerbation of symptoms, it may be therapeutic for them. That's hard to quantitate for an individual. So I say, look, just take it, low and slow, non-impact, safe, um, and in an environment that's, don't go out in the heat of the summer and try to do this. Be in a climate controlled area, and just simple walking is a good therapy. A nice walk outdoors is sometimes good for your body, good for your mental health and everything. So that kind of stuff.
Definitely. Well, I think that is the last question that we have right now. And I just wanted to say thank you again, Shawn, for spending your time with us today and providing this information. I think it's very beneficial and helpful to um, a variety of people that we serve, along with professionals as well. So, anything you'd like to say before we wrap up?
No, just again, thank you for having me. I think this is an opportunity to help a lot of people out there, and just really happy to help and assist anyone in any way possible.
Well, thank you very much. Thank you, everyone, and have a good rest of your day.